morning, guys. Hope y'all having an awesome day. My day is kind of, this morning is full of anxiety. Y'all know I had my tonsillectomy. Today is 9 days from having the tonsillectomy. I notice when I wake up in the morning, my throat is more stiff, a little bit sore. So I instantly start my antibiotics and ibuprofen and different things like that. So got a little more information, guys. So now I'm faced with the decision of reliving this whole traumatic experience and going through it again. Okay, so if y'all remember, some people that remember me from TikTok, about 2.5 years ago, I had a dental procedure done, and the dentist worked on my mouth for 4 hours and did not provide an antibiotic. So we know when we do antibiotic, our mouth is very poisonous, the blood and all that. And when the dentist is drawing in your mouth, and even though they're using that suction, sometimes that blood seeps and you're swallowing it. So what happened was, I had the procedure done in February. I walked around from February all the way to June till my body went into septic shock. And I thought I was having COVID episodes. And finally, some told me, if you don't dial 911, you're going to die. I dialed 911. The paramedics, first the fire department came. They said, oh, she okay. And we just going to leave her here. Then shut up. Stop it. Then the rescue department showed up. The ambulance. Y'all know I'm crunchy. People are like, what's the ambulance? I say the thing. They go, I'm country, y'all. And I also have a speech impediment. So some words I cannot pronounce. So I'm not going to bullshit like I can. I really sincerely can't. Gina want to say good morning. She said, like a fucking cat. Go ahead on. I'm trying to tell them what's happening, Gina. We got some soul searching to do today. Okay, so anyway, the ambulance said, you know what? No. She said, ma'am, did you just work out or do some extra activity with your partner or whatever? And I said, no. I said, you run down the stairs? I said, no, I just got out of bed, dialed 911, and came and sat in the kitchen so I could open the door when y'all could. She told the fire department, she said, this lady heart rate is through the roof. Way through the roof. Like she done ran a marathon, and she's saying she ain't doing nothing to make her heart. And her heart is racing now like if I'm jogging or running. Like she said, you would get that. And she said, you ain't get no activity. I said, no activity. My blood pressure was low. I had the chills. I had fever and all that. And they said, I'm going to take her to the hospital. Thank God she did. They took me to the hospital, and they wind up, treating me. But blood cultures take a while to come back. So they wind up treating me with antibiotics, sending me home. So that buyed me some time. 3 days later, because I don't answer no calls I don't know. Your number ain't in my phone. You don't supposed to be calling me. I do not take unknown calls. Period. So the emergency department had been calling me for 3 days. So I go downstairs, somebody banging on my door. I don't answer. I think it's the neighbor, right? I think it's the neighbor. And I open the door. It's the fire department, the police, and the ambulance. And they got a stretcher right there. And I opened. I said, oh, no, y'all got the wrong house. Y'all at the wrong house. I ain't called for no ambulance. She said, no, shut the door. She said, are you Anne-Marie? Are you Anne-Marie? Anne-Marie? And I said, yeah. She said, did you go to the doctor 3 days ago? I said, yeah. She said, no, we at the right door. You need to come with us right now. I'm like, what? You got to come with us right now. So anyway, I wound up going with them. They surrounded around me and infested disease control and started asking all these questions. And hey, when the last time you been to the dentist? And I said, back in February. They looked at each other. They said, that's where she got it from. They said, well, ma'am, we're glad you look so pretty, because I did my makeup. He said, where was you going? I said, I was going out to pay some bills. He said, ma'am, unfortunately, you won't be going out paying bills today. He said, we're creating a room for you right now. You have septis. It made it into your bloodstream. We finna send you down to a CT scan, because septis attacks your lungs, your heart. And they said when you came here, you was going into septic shock. I guess the antibiotic started reversing it when they gave you antibiotic when you was here. He said, but unfortunately, you're not going home. You're not going. Gino, stop. Stop. I'm trying to tell this story. It's important, babe. It's real important. So when I got the sepsis, I noticed that I kept getting, like, I look at the back of my mouth, and I kept getting tonsil stones and all this white stuff. It connects all to the back of my throat. And I've never, ever had any of these chronic problems with my throat or none of that. Nothing at all. Never had any of this. So when they take out your tonsils, which is great because I guess they test for cancer and everything. When they take out your tonsils, they test the tissues. So I read my results yesterday, and they tested my tissue in the back of my throat. And they said that I have whatever words, I can't pronounce it. But what this is my tonsils was inflamed and infected due to a viral bacterial infection that I had. So that's what kept causing and kept reoccurring for this to come back. A viral bacterial infection. What was that, y'all? Sepsis. So when I talked to a lawyer a while back and told him my story and everything, he said, well, how it works is, Marie, is, okay, with sepsis, if you could take antibiotics and get a full recovery, we don't feel that we will win a malpractice. He said, you will have to show consistent pain or long-term, that it's affecting your long-term health. And then we can look at it under malpractice. But if you could take antibiotics and doctors expecting you have a full recovery, because they get ready to start sending me to the chemo doctors, because sepsis show up in your blood and attack your white blood cells, what gives you the rating like you got cancer. So the cancer doctor called me. He said, hey, Marie, listen, you can come here if you want to. He said, I looked at your chart. I looked at all, you was a healthy woman before you came in contact with septic shock. He said, all of your stuff that's going on and all these white blood cells and all this crazy stuff going on in your blood is a result of sepsis. He said, no sense of us coming doing these painful blood tests on you. Stop and be quiet. Testing you for cancer, when I will affirmably say, I've been dealing with cancer a long time. You don't have cancer. You don't have cancer. You are dealing with the effects from sepsis, and you're going to have to just keep on the antibiotics. So I was in the hospital 10 days on IV drip, 4 hours on, 4 hours out, 4 hours on. Then when I got home, they gave me the heaviest dose of antibiotic that when I was home. But they actually wanted to put a PICC line in my chest to administer the antibiotics into me. But my insurance was like, no, they rather for me to stay in the hospital than to pay for me to get a PICC line, because a PICC line, the nurse come out. So the insurance company's like, no, leave it there, and we'll pay for that versus her coming out. And I'm like, that hospital stay was $30,000 for me in there for them 10 days. But anyway, with me saying all of this to you guys, I've been having severe pain sometimes, and it's through my legs. So now I'm starting doing research. What's the long-term effect from people recovering from septic shock? And they have a lot of information. So you see, they had to remove my tonsils due from a bacterial infection. So the information I kept consistently since I recovered from sepsis. From the past 2 years, I've been studying, having emergency room visits and doctor's visits, getting shots of antibiotic. So even though the sepsis is out, it's causing me long-term effect, where now I got to go back to the painstaking. I'm not going to go to that turn. I got to find another turning. So now I feel like it's life-altering. I got 1 year left for this malpractice. So another thing that I was reading up on, and I want to get it right because there's a lot going on. And so anyway, people with sepsis, they suffer from a lot of anxiety, depression. Now, I'm not going to lie. I did lose my son, and I do have anxiety and depression. But y'all, I woke up out of nowhere and just stopped doing everything I was doing. So they say people that had septic shock go through deep anxiety, depression, inflammation. My legs would be aching like I done ran a marathon, and I ain't been and even did a workout. Then I wake up and my legs be throbbing and aching. So all that is that inflammation in my body. But my doctors and them, I guess, they figure when they check my blood, the sepsis is out of my blood, I'm okay. But not looking at the long-term effect behind sepsis. Another sepsis thing, and they say it's like considered a disability. So they said that most people that have went into septic shock and survived sepsis. And I'm going to be honest, it's kind of scared me. And I know I can't read everything on the internet. They say most people that have survived sepsis, they live 5 years behind sepsis. But due to them being infected with sepsis, like now my autoimmune defense is down. Y'all notice I have to take my tonsils. So I don't have the tonsils now to fight the lymph nodes and stuff like that. And every time I get anything, I got to run and go get antibiotics because I can't take a chance. It's not even getting COVID. I got to run and be antibiotic, everything. So now everything that's going on with me, I have to take it seriouser because I've been exposed to septic shock that anything can get, I can get a toe and that toe can get halfway. I got to run and get antibiotics because if anything happened and I let it fester because I've been exposed to sepsis, I'm at a higher risk to being reinfected with sepsis. So all this is due to the doctor failing to give me an antibiotic. And the last thing is post-sepsis syndrome that you also experience from septic shock. And I have a fear. I have a serious fear, like every time, oh my God, because when you come near death, it scares the hell out of you. So now today, what I got to do is go through all this blood staking stuff all over again. I got to go pull my dental records so they can see when I had the procedure done. I got to go pull the hospital record so they could see when I was hospitalized for sepsis. I got to pull this surgery I just had where it could show that my tonsils had to be removed due to a bacterial infection that was in my mouth. And I also got to pull my medical records from my doctor, how I was frequently going. So within the past 2 years, I still been having pain from complication from sepsis. So to me, that's pain and suffering. And it's like, I'm in my biggest fear now, right? And I'm going to have to go to my doctor. And she know I got a lot of anxiety. So y'all, fill me out on this, what my biggest fear is now. Now that they took my tonsils, right? So the infection can't form because it's in me. It's in my blood. And it's not, in the sepsis, they say it's not like, I don't have sepsis anymore. But it was not contagious to that degree. Let somebody get the blood or whatever. But so what I'm thinking, that is me. They found inflammation due from a viral bacterial infection. So mean the sepsis was gone, but I still have information in that and whatever that gene is for that viral bacterial infection that lived. So what if it can't now come out through my tonsils and adenoids, my tonsils and lymph nodes, because they took them, right? What do you think that chronic pain is going to manifest at now? It ain't going to be in my throat. It's going to go throughout my body. So that means I can continue to have chronic pain and not understanding why. And we all know I've been on ibuprofen, but ibuprofen is not good for your kidneys. You continue to take ibuprofen, it affects your kidneys. So yes, now I feel that and the doctor is so nice. He's such a nice doctor, and I don't think that he did it intentionally. But it was negligent for him not to give me an antibiotic to be in my mouth, and knowing how dangerous the mouth is and the bacteria in the blood, for him not to do his due diligence and put me on an antibiotic. I'm 50 now. So when you get older, your body changes. Now I'm at higher risk for a lot of stuff. So I feel like now I don't have a choice but to make that conscious decision to move forward now with a lawsuit, because that's where everything is stemmed from. The sepsis I was exposed to. Everything stemmed from that. So it's like, I already have hypertension, so, but that's under control. But it's like everything was stemmed due to me being infected with sepsis. So now I have no other choice but to go again, and I got to get the right attorneys that'll pull the file. The evidence is right there. So now I got to go to the point of going to my doctor and sitting down with her and have her now to connect the dots, just like I just did for myself. My doctor's a really good doctor, because now she's going to have to diagnose me with this chronic Cause she been constantly giving me muscle relaxers and ibuprofen and popping all this stuff, thinking it's just regular muscle spasm. No, it's inflammation due to the long term of somebody that went into septic shock. That's where all that throbbing and pain and all that crap is coming from. It made it into my blood, y'all. So if it made it into my blood, it's in my bones now. Even though the sepsis is gone. But the long-term effect of being exposed to sepsis now is a hinder to my life. So the first Lord said, we can't do nothing. You get better. It didn't get better. It's manifesting. It's keep going in that direction. So I am about to look for attorneys. And I'm having anxiety, y'all, because this, but at the same time, when doctors and people do stuff wrong, I think it helps them to learn to do better. And I like the doctor. He's a really good doctor. He do phenomenal work on my mouth. But he also gave me a phenomenal infection that could have killed me. I could have been dead. And, you know, he apologized. He go, oh, Marie, I'm sorry, you know. And I don't think he did it intentionally, but I said, you're not suing him. They got malpractice insurance. You're going to sue their clinic. You just can't ever go there no more, because if they find out you got all these chronic illness and infections that you had, they going to disbar me anyway, because they going to feel I'm a liability. Because I don't know how he knew. And I did tell that damn lady that kept calling me. I think I had a little balance. And she kept calling. I said, don't call my phone no more. Shit, I've been in the hospital with sepsis behind a dental procedure y'all did. And I been, oh, I'm going to call y'all and I'm going to pay y'all. And I paid them. And I've been back there since I had this now. So I've been back there. And I've had more dental work done. But as a precaution now, every time he touch my mouth and he going to be jiggling around, pulling tooth or cause any bleeding, he puts me on the antibiotic now automatically. It's in my record. Anybody going to be fucking around in my mouth and make me bleed, I need to be on antibiotics. We don't take no chances. Even when I just went to the surgeon, he probably knew I had sepsis, but probably wasn't sure. So when I left that message, that doctor did his due diligence and pulled them records. And you see he gave me 2 doses of antibiotics. Oh, no, yeah, And I bet you now that test came back, he glad he did put me on antibiotics. Because some people, oh, no, we're not going to do that. The surgeon did that. He put me on that. So now I got to go through the painstaking of going to my doctor. And it ain't what you know, it's what you can prove. This chronic inflammation, muscles, aches, and all that I'm having is due to my exposure with sepsis. And this is now, like they say, some people have it forever, is a life-altering thing. I'm at 50 years old, had to go and get my tonsils removed. Through the grace of God, it went real smooth for me, but I'm still concerned about the long-term effect. And I don't want to look up, and I'm 50-something, 55, 56, and I'm having a whole thing of pain, and then it go back, and they go, yeah, well, you know, this pain came from when you had sepsis. All this stemmed from sepsis. And then the time for malpractice been ran out, and I'll be just dealing with life pain and life-altering things, and that'll be that. Money all the time don't make it better, but money teach facilities to do better. It wakes them up. They won't make another critical mistake like this, because somebody else, he can do that too, and they can die. They can die behind it, you know, him doing that and not administering and stuff like that. So as a precaution, he needs to do that. So guys, I'm going to get off here. Got to get on the phone. Got to go through all this again, finding the right lawyer that's going to listen. And they got to listen, and you can connect the dots, and it's the way you explain it to them and all that. It's not what you know, it's what you can prove. But the first lawyer said, oh, if antibiotic heals you, then there's no lawsuit. People that get paid, it shows a lifelong alteration. I think my life now has been lifelong alterations with altered. And excuse me if I'm not pronouncing the words right. Yeah. So, but thank you guys so much for listening, and wish me luck on finding a good attorney that can hear me. And if y'all got any advice for me, put it in the comments and let me know. But that's the next journey that I'm going through, and I got to get this done before 2025, because it'll be 4 years and nothing else can get done. So I'm gonna ask them to, I'll give y'all permission to pull all my medical records, look at it, study it, get back to me. But the next thing I got to do is I got to get diagnosed. I got to get diagnosed with, I already got diagnosed with chronic tonsillitis. So now I got to get diagnosed with chronic inflammation. I got to get diagnosed with that. And then it pretty much I got to get it on the record for them to say that your chronic inflammation have came from your exposure to septis. So that's when, then that septis shock syndrome. So all that anxiety, and you, okay, so they can say, the Lord say, well, this woman been had anxiety and depression. She been had that. So how we could say that septis gave her that when she been had it, all of a sudden it increase even better, even worse. And I haven't had any other triggers besides, I don't have nothing going on in my life where it's stressful like that. You know what I mean? Me and my friend grew up, but that's something, shit, I can push a block and that's done. You know, defense, I'm not going to argue with nobody. Shit, I'm not going to be doing that. But no, it's this. And now the fear, the anxiety, all that. And every time I'm going to the doctor, first I say, hey, I had sepsis. What, y'all going to give me antibiotics? They be like, we just finna check on you. You don't need no antibiotics, girl. Shit, I be antibiotic down. I had so many antibiotics when I was on it. It's funny that when I would rub my skin, and because I was on antibiotic in the vein, I could smell the antibiotic coming off me. That's how antibiotic I was. But the antibiotics saved my life. So thank y'all for listening. And I'll let y'all know what happened if I find a lawyer and what's the next step. Because I think now I got to get diagnosed with that chronic septis inflammation. Okay, not inflammation like inflammation, but inflamed, like your body inflamed. So forgive me for the speech impediment. All right, guys, toodles.